it's technology, but we started from there is a problem we need to solve that I thought we needed to solve, but I didn't know how to solve it. And then we got all these people involved, and we've had good help from the vendor community, the technology community, but they all then appreciated that we were solving a problem that wasn't just to provide gaming, it was actually therapy through gaming, right? Because it's therapeutic. So we have gaming
Yeah.
specialists now, and they were explaining to me that it's therapeutic for kids to be able to escape somewhere when they're going through a massive amount of pain
Oh
and
yeah.
multiple surgeries and things that you wouldn't wish on anyone, right? So that's why I'm saying the job that I'm in isn't to just go and I could have just gone out and bought 100 PS5s, right? But that wouldn't have solved for what we
No.
were trying to solve for. That would have been my idea of thinking, oh, that's a cool thing. But in this networked environment, all the kids are in that environment. So they can play amongst themselves, they can fight each other. Even I can go in there as a user from campus and they can fight me. They can shoot me if that's what they want to do, deconstruct me. So that's a different way of looking at something than, oh, Zafar solved a problem because he placed an order for 300 PS5s.
Yeah. Well, that feels like, and I think that's what gets lost so much in healthcare to this day is you built the technology truly around the outcome you're looking to achieve, which is improving it for those kids, improving their experience, whatever that might be. And it feels like, and I go back to EHRs all the time because coming from class, and then I've lost track of the number of physicians I've talked to, and almost universally, they just don't like using EHRs. And some of them will say these weren't built for us. Somehow we're using them, but you can tell it was not designed for us. And then it wasn't designed for the patient. And they ask, like, who is this really designed for? Who's the primary beneficiary of EHRs being used? And like most nurses and docs say, it's not really for us. But what you're describing is, and we don't have enough time to get into my conspiracy theory on the modern EHR and how that actually came about in the United States. But that issue with Minecraft and the kids, it was you can tell it was completely done for them, as opposed to there's so much other tech in healthcare. Because I use patient portals, I used Epic's patient portal and Cerner's. I think they all
Yeah.
suck. Personally, I'm like, this isn't designed for me. This is a very, very different experience than I have with apps that I want. I'm putting an app on my phone. I get to choose the one that really, really works for me for whatever it might be. The healthcare ones, almost without exception, I just don't like. I'm like, they don't feel like they were designed for a real patient or for a real doctor. It always feels like there was some other motive behind it. It's kind of for you, but there's really another purpose for it.
Well, it's a closed ecosystem, right? So the difference in healthcare software is a lot of it's a closed ecosystem,
It's true.
and tech
That's
savvy
a good point.
patients are now used to an open ecosystem. That's why many bright technology people like the Android versus the Apple platform because it's more open, they can configure more, they can change more. And
Good point.
Apple will say, well, it's because we're more secure. And I see both sides of the argument. But you as a consumer now want to choose what you download and you want to choose the experience you have. And what you're used to outside of healthcare software is the different companies vying to entice you and amaze
Mm,
you into their ecosystem. That's the delta difference. Because when I download the Walmart app,
yes.
every few days they add features to entice me to stay in their ecosystem, to continue to be a customer, to continue to be excited, because they know that others are also vying for me in that ecosystem. In healthcare software, what you're finding is the ecosystem is closed and we as a patient are being dictated to. That's why you don't have
Mm,
the experience you want. Whereas in retail, if you don't like the Walmart experience, you might like the Nordstrom experience. You might like the Target experience. They're all vying for you, whereas in healthcare software, they're not vying for you. They're telling you this is how you would consume, and
Wow.
you have to either like it or you don't like it, or you just have to work with it because what other choice do you have as a patient, right? If I want to go on my app and book an appointment, I only have the one choice.